Well, thank you all for coming so early in the morning. Hopefully that you're enjoying your breakfast. Also, thank you to Avecchia for hosting us and helping us create this unique event. We've been really excited about it and are excited to start cooking as well. Just so you guys know, we will be live tweeting this. So if any of you are on the Twitter, please follow us and do whatever you're supposed to do, which I'm still vaguely unfamiliar with because I'm old. Before we begin, let me introduce our experts to you. First, we have Dr. Andrew Ragg. He is the Clinical Director of Audit and Governance and a clinical cardiologist. Professor Amrita Ahluwalia, who is the Deputy Director of the William Harvey Research Institute at the medical school and also a Professor of Vascular Pharmacology. And Matt Lovell, sports nutritionist, who has worked with the English rugby team as well as Tottenham and Man City, to name a few Premier Leagues and many other places he's worked with. They're here to tell you a little bit about how to improve your cardiovascular health through your diet and why. We might have time for a couple of questions at the end, but if we don't worry. They will be walking around throughout the cooking experience and they'll be available afterwards. And speaking of the cooking experience, you will have noticed on your name tags there is a 1 or a 2. If you are a 1, after we're done, you will stay in here and be at one of these 3 pods. If you're a 2, you will cross the hallway into the other room. Belinda, Sam, some of our other colleagues will help you go over there and you'll be cooking on the other side. After the cooking, we will provide you with a goodie bag in which you can put your takeaway lunch in, and that will be located on the bar, which is where you picked up your name tags. Before we get into the science and nutrition, I will tell you a little bit about the charity itself and about Circulate. Barts Charity is an independent healthcare charity that raises funds for innovative healthcare across the Barts Health NHS Trust. Many of you know Barts Hospital, where the Barts Heart Center is located, but also we have a wide expanse, which includes the Royal London in Whitechapel, Newham in Newham, Whipps Cross in Leighton, and the medical school. So it's a wide and disparate population that we serve. The best part about Barts Charity is that 100% of all of your donations go directly to the cause. And we also fund only innovative projects. Circulate, the Barts Charity Heart Health Network, is why you're here today. And some of you will have heard this at the November launch. I think there were a fair amount of you that were there. But essentially, Barts Charity and the Barts Heart Center share the city's vision for a sustainable, healthy, and profitable City of London. In that, we are hoping to create a network of local businesses to promote health and well-being. The goals of Circulate are, 1, to help people, much like yourselves, improve their cardiovascular health, but also to fund innovation at the Barts Heart Center, which includes state-of-the-art equipment and groundbreaking research, some of which you will hear a little bit later from Professor Ahluwalia. The impact of Circulate will be both immediate with patient care and treatment, but also long-term with education and prevention. Some of the members of Circulate have already experienced some of the perks, which are having a consultant cardiologist come to your office and give presentations. I believe Osborne Clark, Linklaters, Hogan Levels, and Allen and Overy have all had people come. So if you want to learn a little more about that, ask one of them. And there's also one pager about Circulate in your goodie bag on your way out. Now you might be asking, that's so good that you're doing all that. What can we do for you? Because I know you all are. Well, first, you could donate. There's a donation envelope in your goodie bag, surprisingly. But more importantly, be an advocate, which means when you go back to your office, please tell everyone else about our events because they're open to everybody. And we want to get awareness out there. And also fundraise for us. Challenge events, Tough Mothers, traditional runs, whatever you like doing, there is something that we can do for you. And there is also, once again, a leaflet in your goodie bag that will let you know how to sign up for those. And I believe we have Lynn from Osborne Clark here who's running the marathon next month. So let's give her a hand. If you have any other questions, my contact information will be at the end of this presentation, but you can also see anyone with a Barts Charity name tag and ask them any questions you have. Now, let me pass you on to Dr. Andrew Ragg, who will tell you a little bit about Barts Heart Center, cardiovascular disease, and risk factors.
Well, thanks so much for coming, everybody. I'm one of the interventional cardiologists who works at the Barts Heart Centre. This is a picture of it here, and it really is a remarkable building. It's a brand new PFI, state-of-the-art facility that we moved into about a year ago. And what's really quite unique about it is that there were 3 very big cardiac centres in this part of London. One at Barts, the London Chest Hospital in Bethnal Green, which was a major heart attack centre in its own right, and also the cardiac centre of UCLH at the Heart Hospital, and they were all merged together to recreate this very big, large cardiac centre, which is now full of expertise and actually full of patients with disease and need, which hopefully we can talk a little bit about more over the course of this morning. Cardiovascular disease generally, and heart disease, fortunately is decreasing, but actually it's by no means gone away, and it's still a big problem, and all of us are at real risk of it at some stage in our lives. Hopefully not now, hopefully that's a distant future, but it's still a tremendous public health problem. If you look at actually the amount of lost and premature lives that get taken because of heart disease, it's still up there at the top of the table of the causes of premature death. And actually heart disease and cardiovascular disease is still equally important to all of the other cancers put together as a cause of harm. So I don't want to be too gloomy, but I just want to make the case that we still need your help. There's lots to do, despite the great progress that's already been achieved with heart disease. Now, we're here to talk about diet today, but what I thought would be interesting just to put in the context of how important your diet is for your health. So the Gates Foundation, they funded a global piece of research where they tried to look and define what were all the causes of death within a nation, and what were the major risk factors that were associated with causing that premature death. And this is a list for the UK that was published in the Lancet a year or 2 ago, and these are ranked by order of what is the most important risk factor, and all the others are under it. And this isn't just for cardiovascular health, although to be honest, it's cardiovascular disease that mainly drives the numbers that make up these events. But actually what you'll notice that all the things in red are all the things that are related to diet. And so diet low in fruit, 5th major risk factor in the UK for avoidable causes of death, followed by diet low in nuts and seeds, vegetables, and other things. So I hope you'll believe the pitch that the context of what we're here today is to learn how to cook nice, tasty food with a bit of expertise, but also making sure we understand what's really healthy and how to be more healthier is a real great goal of Circulate. And certainly it's our desire, as much as I love doing an angioplasty and it's my passion and what I'm trained to do, I don't want to be doing it on you, and I'm sure you don't want to meet me in other circumstances. So before I hand over to talk a little bit about some of the science that we are doing, that we would like your help with, I think it's important to emphasise some real key things that I'm passionate about, which is, as a heart doctor, making sure people really understand the important things. And I want to just spend one slide talking about the 5 a day. So you've all heard of 5 a day, and you'll think, where did 5 a day come from? Which expert made that up? Was it someone in an office in the Department of Health? And actually, it's one of the most powerful, important bits of public health information out there. And the reason is it's based on pure evidence. There are now hundreds of thousands of patients in studies that have shown that the more fruit and veg you eat has a significant effect and decreases the risk of you dying. And for every piece of fruit and veg you eat, up to about 5, you significantly drop your risk of death. And that risk of death is mainly, again, about cardiovascular disease, heart disease, stroke, these types of things. And this doesn't matter whether you're thin, whether you're fat, whether you're fit, whether you're unfit. It's an independently positive thing to do. And so the 5 a day is recommended because, as you'll see from this graph, up to about 5 a day, you're almost peaking at the benefit, but the benefit is dramatic. And for every piece of fruit or veg you can add to your diet, if you're not in that healthy part of the curve, you're dropping your risk of death by about 5%. It's really powerful. So there are very few things you can do that are so easy and so achievable, other than just making sure you're maximising the amount of fruit and vegetables that you eat each day. And so I'm now going to hand over to Amrita, because why is fruit and vegetables so healthy for you? We know that. We've got some really good information about it. And actually the research behind fruit and vegetables is really being well understood, which actually hopefully will empower you also to continue to work at your diet. And it is avoidable. So if we could all have a healthy diet, if we could all exercise as we're recommended, and the exercise guidance is based on similar really good evidence, if we could all have the right body mass index, that's the right weight, if we all didn't smoke, they're the major avoidable risk factors. If all of those things were done, 80% of heart disease would just disappear. Sadly, only 1% of people in the UK have that profile of the right diet, the right amount of exercise, the right weight, and they don't smoke. So there's lots to do. Some of us may be better or less at other things, but it's all very achievable with a bit of focus and a bit of help from us at Circulate.
So I'm one of the scientists that lives in the medical school that's associated with Barts. And if you remember on Andy's slide where he was showing the key risk factors for early mortality in the study that was funded by the Gates Foundation, actually number one, which wasn't in red, the number one risk factor for premature mortality is high blood pressure. And actually it turns out that the incidence of high blood pressure plays a significant I think it's something like 50% of cardiovascular disease mortality is attributed to high blood pressure. And a large proportion of that cardiovascular disease actually can be mitigated by eating the right diet. There's lots of good evidence to support that. And actually the first study that raised this concept of diet, healthy fruit and vegetables having an impact on blood pressure was the Dietary Approaches to Stop Hypertension study. It was a study that was done in America. The acronym is DASH that everybody uses. And in this study, what they did is they took some average Americans and they divided them up into 3 groups. And they put those 3 different groups onto different diets. The control diet, the group that got the control diet actually was quite happy at the beginning because they were going to have to stay on this diet for 8 weeks. It was a replica of the average American diet at the time, which unfortunately, very little fruit and vegetable, practically no fiber, and lots of fat. They were happy at the beginning, but they weren't happy at the end of the study when the results came out. And what you see here, there are 2 graphs. There's systolic blood pressure and diastolic blood pressure. I can explain this a bit more if any of you are a bit uncertain about it, but they give measures. They're the peak and the trough of your blood pressure at every beat of the heart. And what they showed is that in the controls, you can see blood pressure here, in this group of individuals is actually sitting at the borders of being slightly unhealthy. And in a second group, the fruit and vegetable group, what these people did is they ate the same diet as the control diet, so the average American diet, but every day they were asked to consume 7 portions of fruit and vegetable a day. So they had that still bad diet, but they were just eating additional fruit and veg. And what you can see over the 8 weeks in which those individuals ate that diet, both their systolic and their diastolic blood pressure was reduced. So that's keeping the same diet, but just adding fruit and vegetables on top. The important thing, and this is important for blood pressure regulation because it's hard to keep blood pressure down with any intervention and sustain it down, is that this blood pressure drop didn't disappear after a few days of eating the fruit and veg. It stayed as long as they consumed the vegetables. Now, the lowest actually is the best diet. It was some added fiber, reduction of some of the fat that they were consuming, as well as the fruit and vegetables. So, fruit and vegetables reduce your blood pressure. So what is it in the fruit and vegetables that underlies this blood pressure lowering effect? Well, again, there have been some massive studies in the US where they have followed people over prolonged periods of time and they've analysed their dietary intake. And what they have discovered is that, yes, fruit and vegetables lower your blood pressure. They reduce the number of heart attacks. They reduce the number of strokes that individuals get if they're consuming between up to, the best effect is again at 5 to 7 portions a day. But actually, interrogation of that data even further has demonstrated that the greatest beneficial effect actually comes from green leafy vegetables. Now, I've got some examples of green leafy vegetable here, and yes, it does also include the beetroot because, as you see, they've got big, large green leaves. I know we eat the root, but these vegetables contain lots of good things. We know about antioxidants, we've heard about antioxidants, but there's something else that's in these green leafy vegetables that there has been a great deal of research on over the past 10, 12 years, and that is a chemical called nitrate, inorganic nitrate. This is the structure of nitrate. It's an anion, NO3-. So this is a little bit of geeky science, and I'm showing it to you because there's something really cool about this, the pathway that we have discovered that underlies why nitrate is good for you. So when you consume a dietary food that has a high nitrate content, whether it's beetroot or a green leafy vegetable. Almost all of the nitrate contained within that vegetable actually gets into your blood. And this is some data that we collected from people with healthy volunteers. So these are young, healthy people, much like the majority of you here in this audience. It shows that within minutes, so this is hours along the bottom, within minutes, the level of nitrate in the blood goes up. So it's very rapidly, easily absorbed. Now, the vast majority of that nitrate, about 75%, is excreted by the kidneys. But this is the really curious thing. About 20 to 25% of that nitrate, we extract it from our blood into the salivary glands. And then once it's in the salivary glands, that nitrate gets secreted with your saliva into your mouth. And this is the really cool part. Nitrate as a chemical is useless to us as mammals. We don't have any enzymes, any pathways that can convert it into anything good. But there are bacteria that have colonized our oral cavity, and they can use nitrate. And they convert it to, oh dear, they convert it to this chemical here, sorry, called nitrite. The nitrite is now in the saliva. You can't help but swallow your saliva. And what we have discovered is that it gets into the blood. And it's a slight rise, but it takes a bit of time because of that circuit, and you get a rise of nitrite in your blood. That nitrite in the blood, actually, we are very good at converting nitrite into something good. We convert it to this chemical, nitric oxide. And when nitric oxide gets generated in your blood vessels, it causes the blood vessels to open up, to relax, decrease resistance to blood flow, and what happens is your blood pressure comes down. Now, what we've demonstrated is this blood pressure lowering effect. It's dose dependent. It means the more nitrate you take, the greater the effect. It's also true that it works in people with high blood pressure. We've done a clinical study and shown that people with raised blood pressure, their blood pressure is lowered. And the other thing that we've shown, just like DASH, is that that blood pressure lowering effect doesn't wane over time. It stays there as long as you're consuming the inorganic nitrate. So nitrate plays a role. It isn't the sole constituent in our fruit and vegetables that are responsible for the beneficial effect, but I am almost certain that it plays a major role in underlying some of the benefits of fruit and veg. But actually, I'm going to hand over to Matt now, who's going to tell you about some of the other constituents in your fruit and vegetables that might have a role.
So high blood pressure was mentioned as one of the major risk factors, and it really is. It's not called the silent killer for the wrong reasons. So as well as obviously taking those nitrate-rich vegetables and beetroot juices and so on, there's a number of other things that you can do which will moderate a high blood pressure. And one of the most effective things is actually maintaining a normal body weight. And the best way to do that is by adjusting your calorie intake, partaking in regular exercise, and consuming less of the wrong type of foods and more of the right type of foods. So it's something I specialise in, and it's something that I would get most athletes to do before they did anything else, was adjust their vegetable balance and look at intaking higher levels of proteins and lower levels of overall sugars, as well as adjusting the right balance of the good fats, which I'll speak to you about in a minute. Essentially, when you develop cardiovascular disease, what happens is the fats in your blood become oxidized, get sticky, the immune system gets overactive through raised levels of inflammation, and then the plaques form and so on, and then you develop the cardiovascular disease. That's one of the main processes. So things that you can do to prevent oxidation will obviously prevent that process from happening too rapidly. And the antioxidant-rich foods really are the way forward in that sort of sense. My preference in terms of fruit consumption is always geared towards the berry kingdom, because I think you get far more benefit from consuming berries over and above some of the other maybe more tropical fruits such as bananas and mangoes and so on. But really the message is to increase all vegetables and fruits with an emphasis perhaps skewed towards vegetable consumption. Perhaps 2/3 vegetables and 1/3 fruits would be the right way to go. I'm normally recommending nine servings of veg and 3 fruits as a general rule. It sounds like a lot, but it's actually only 80 to 100 grams, so it's a relatively small serving which will get you there. So a large mixed salad, big plates of steamed and roasted vegetables, perhaps a bowl of soup across a day will get you pretty close to 9 servings without too much trouble. As with all these areas, they're quite frequently studied, so that the berry kingdom has been shown to reduce oxidation. It's been shown a moderate increase in berry consumption has been shown to alter your cholesterol profile more favourably. Fibre is very important, so there's porridge on today. There's a type of fibre in porridge called beta-glucan, which favourably alters your cholesterol profile. You'll get the same beta-glucans occurring in things like mushrooms and pearl barley, and yeast consumption can also help with that as well. So the take-home message from this one, I will always tell someone if it's going to stain your shirt, then it's probably a good idea to increase consumption of those foods in general. So beetroot's an obvious one, chili pepper, spices, paprika. This is perhaps an area that many people neglect in their cooking. It does actually make your food taste very nice. So marinades, fresh herbs, dried herbs, all the rest of it can all contribute to your overall antioxidant protective balance. They're very rich in chemicals called carotenoids, which are also protective, not just for cardiovascular disease, but also for many other diseases as well. One of the key things about these foods is that they're very rich in polyphenols. And there's a sort of displacement factor when you're working with someone on the diet. If they're spending all their time eating one thing, it normally means they've not got enough room or time to eat other things. So in terms of displacement factor and body composition and weight management, one of the take-home rules is perhaps drink less calories. So drinking less calories would mean stopping taking things like sodas, excess levels of fruit juices, maybe switching from lattes with added caramel and things like that to more regular consumption of green teas and decaf coffees and so on. So these foods, the common denominator about all these foods is they will help your body regulate blood glucose properly. So one of the things about allowing your body to tap into its fat as a source of fuel is if you keep your blood glucose nice and steady, you can mobilize and use your body fat more effectively and then maintain a better body mass. So regular introduction of all these foods will help you do that. And this shows that the overall reduction in sugary-based foods or high glycemic foods really will help your body produce less insulin in response to a meal. So what can happen is, because we overconsume processed, starchy, refined carbohydrates, is as soon as we start eating maybe toast or cereal for breakfast, our blood sugars and insulin levels will go up, and then they will stay relatively raised throughout the whole day, because we might think about a cup of coffee and a Kit Kat, other type of starchy type breakfasts. And in that environment, in a high insulin environment, it's not good for favourable cholesterol profile. So just switching from white bread to rye bread will cause a much lower level of blood glucose rising in the blood following the meal that you've just had. Okay, wanted to just finish on this slide, and I've put out a list of oils and their burn points. So if you drive around London, around the back of a lot of fast food restaurants, you'll see these huge vats of long life vegetable oil around the back. More or less every fast processed food and many restaurants use vegetable oil as a major oil in their cooking. And this is important because if you have too much vegetable oil in relation to omega-3 fats, what that does is it increases inflammatory pathways in the body. So that inflammatory driven process where you can develop a heart disease and other diseases will be pushed faster through a diet which is skewed in the favour of these refined type vegetable oils. So if you have that in your kitchen, it would be a good idea actually to probably throw that away and switch to olive oils, coconut oils and oils with a better burn point. And I think that's all I'm going to say for this morning. Yeah.
So yes, thank you, Matt, Amrita, and Andrew. That really does give a lot of information behind what we're doing today and what you've been eating as well. And I think we can agree that the takeaways are 5 to 7 portions, do it, mostly vegetables. Olive oil, good, but don't fry with it. And green leafy vegetables will apparently cure everything. So oily fish and beetroot are also important, which is very timely because you're about to do some hands-on cooking to make either a mackerel dish or a beetroot dish, which with Michelin-trained chefs, one of whom is about to tell you a little bit more about the dishes. But before I do that, I just wanted to let you guys know that also in your goodie bag is a voucher for a Vecchia and courtesy of our friends at James White, I don't know if someone's here, a beetroot shot of nitrates and a beetroot flapjack. So following the cooking experience, please make sure you pick up your bag because that's also how you'll take your lunch home.